Okay, hello, good morning, good afternoon, good evening, wherever you are. Welcome to the Parkinson's disease mini-series with a focus on posture and breathing. I am Christin. You can see a bunch of letters and stuff after my name there, but I am a physical therapist, and that CSCS just means Strength and Conditioning Specialist. And you can see a picture of me there with my dog, and while that's a current picture of me, my dog is much beefier. That was about 7 months ago, so I can't really pick him up like that anymore, sadly, but he'll be in the background of some of our stuff that we're talking about today. So let's get started. All right, posture and breathing. What do they have to do with each other? How do they affect each other? That's kind of what we'll talk about, some basics in this slide. So you've got a couple pictures there. The first one is a picture of your diaphragm and how it sits in your chest. You can see it's kind of shaped like a parachute, and I'll explain how it moves as we go. So the first couple bullet points: chest and abdominal expansion for a good breath. So as you breathe in, your belly should be able to move out a little bit, and your chest wall should be able to expand out side to side. And then when you exhale, your diaphragm and your intercostals, those are your main muscles that are responsible for a good inhale. When they contract, you get a nice good inhale. When they relax, that causes everything to kind of passively come back to normal as the air gets pushed out of the lungs, or just kind of comes out of the lungs as things return to their normal space and size. So inhale, diaphragm kind of flattens out to the bottom of the rib cage. The lungs inflate, so that rib cage is going to come out side to side and expand. Belly's going to come out. And then as you exhale, everything kind of relaxes and just goes back to its normal position. The upper chest or shoulders shouldn't really move a whole lot when you're breathing normally. Most of your breath should come down to the bottom of the rib cage, to the bottom of that like upper abdominal area. So if you see a lot of chest movement in people when they're breathing, that usually means their breath is too shallow, right? Your shoulders shouldn't be bouncing up and down, and the tip top of your chest shouldn't be moving around a whole lot. Poor posture can contribute to difficulty breathing, because as you get into that stooped posture, you can see that photograph of that progressively stooped posture. What starts to happen is the muscles across the front of the body, especially in the chest, they start to get short and stiff. And so they'll adapt to that stooped posture. And then when you go to take a nice big inhale, there's less room for everything to expand, because those muscles don't want to lengthen back out and give the chest wall the room to move. And so that's how posture can kind of inhibit a nice good inhale, is that as those muscles shorten and stiffen in stooped posture, it just leads to a limitation of the chest wall being able to expand as you breathe in. So what do we do about this posture and breathing interplay? If we notice that maybe we're not getting as deep of a breath as we could, if you notice that your spine or your ribs feel stiff, there's a lot of resistance against your breath, if maybe you notice that you are starting to have some of that forward posture, what can we do about it? Well, the first thing is really becoming aware, right? And if you notice some of those things, then you're already building awareness, which is a great first step. But spend time paying attention to how you sit, how you stand, and how you breathe. You know, when you're standing and sitting, is your head far forward, away from your shoulders? Does the back of your neck feel kind of shortened and tight? You know, sometimes you'll get some achy muscles across the backs of the shoulder blades. And that's something to really be aware of, Right? So if you're able, if you notice those things, we'll talk about some simple postural fixes and how to build some awareness. The next thing as far as breathing is, are your chest and abdomen moving? If they are, what's the quality of that? How well are they moving? And so there's some hands-on checks that you can do for yourself. If you just place your hands in key positions, you can feel your own breath expansion, and you can possibly not only feel, but see your hands moving as you breathe, as your chest or your abdominal cavity expands. And it says video 1 there. In the next slide, there's some videos that we'll go over together that are just different awareness exercises so that you can practice this first piece. So using your breath and body to help you expand, there are ways, there are exercises, there are things that you can do, that you can practice to use your own body to help it start moving better. Okay, so if you think of your lungs like balloons, put some good imaging in your head. Imaging can be really important with any exercise because it really helps the brain understand what should be happening. But think of your lungs like balloons that can help float your upper body into good posture. And I'll explain more about that and what that should look like when we get to the next slide with the videos as part of it. But as you inhale, trying to sit up taller, pull the shoulders back. So really using that balloon to float that chest cavity up and open. And then as you exhale, kind of relaxing back down into maybe what currently is normal posture for you, which we can address as we go. The last video, so it says using specific movement patterns to promote breath expansion and good breath patterns. So there's some exercises, especially from the therapy world. As you noticed on that first slide, I am a physical therapist, so these are things that I've worked with folks on. There are patterns and ways that your body likes to move, or that we move often, that help you get into an expansion position, help open that chest cavity and give the lungs the room to breathe. Okay, so we'll move on to the next slide and we'll do some practice together. All you need is a nice little place to sit down, or you can stand if you prefer, but space that you can move the arms a little bit. So just make sure a wall isn't super close by so you're not whacking your hand on the wall. So here's our practice videos. But that first video at the top, number 1, that's just using the hand placements that I mentioned on the previous slide. So my hand placement, especially the first one, is probably a little low. You want your top hand right at the top of your chest so that you can maybe with your thumb almost feel your collarbone. And then your bottom hand should be, for women, kind of right at your bra line there. And for guys, right at, you can feel the base of your sternum, that kind of pointy bone in the middle of the chest. And so you want your bottom hand right there. And you can see as I sit up nice and tall, or you can stand if you like. As you take a nice slow breath in, preferably through the nose, you want to try and breathe into the bottom hand so that the bottom ribs and the belly should be moving out. And the top hand shouldn't move as much. Okay, so we're taking a nice, a deep breath, or what's called a diaphragmatic breath. And so that bottom hand should be the one doing most of the moving. And then you see as I move my hands to kind of the sides of the bottom of my rib cage, you'll be able to see or feel some movement there as well as you take that nice diaphragmatic breath. Because the bottom is going to want to expand side to side in addition to the front to back. Moving on to the second video. So another piece of the pie with your diaphragm, not only does it help with breathing a lot, that's one of its major functions, or is its major function, it does assist with posture. And so my video here is a bit over exaggerated so that you can see what I'm talking about. But as you inhale, I want you to try and sit up a little taller and pull your shoulders back so that the diaphragm and the lower ribs have room to expand. As you exhale, try and maintain that taller posture. So try and stay in the space that you just created with that inhale, rather than drooping back down. And you can see in that video, like I said, I'm over exaggerating so you can see the difference between the stooped posture and the tall posture. But try not to return to that stooped posture. Take a nice inhale, sitting up nice and tall with the shoulders down and back. And then as you exhale, try and maintain that postural space as you breathe out. Video number 3, we're just using a specific movement pattern to help facilitate room for chest and abdominal expansion during breathing. And so PNF it's a really fancy term in the therapy world. It's called Proprioceptive Neuromuscular Facilitation. Okay, great. Don't expect you to remember that. There will not be a quiz later, so don't worry. But basically, we're just moving in diagonals to promote specific patterns that are maybe a little more functional. And so we've got our arms moving from, think about it, going from opposite pockets and then coming out, allowing room for the chest to expand on the inhale, and then as you exhale, coming back down to opposite pockets. Okay, so shoulders, again, shouldn't be moving up and down a whole lot as you breathe. As the arms open out to the sides, we're just more giving the chest and the belly room to expand as the breath comes in. So we're kind of maybe moving things out of the way, so to speak, or pulling the shoulders down and back so it's easier to get into good posture and give things room to expand that way. So some tips for success if you're struggling. If you're finding that it's a little difficult to either maintain good posture or get a good diaphragmatic, or what we call sometimes a belly breath, what you can do is find a chair that has a back on it and recline or lean back against the back of the chair so that your diaphragm can focus on breathing and not worry about having to help with posture and hold you up. So leaning back on a little bit of an incline or reclined positions, more so, can help you with giving you that breathing space, help open you up into good posture without the muscles having to do it for you just yet. So just a little tip that you can try if you're struggling. So why does all this stuff matter? Right? Our posture, our breathing, we breathe. Okay, great. Why do I have to pay attention to that? Why do I have to think about my posture? However I sit here, however I'm comfortable, big deal. Well, it definitely has its impacts, and that it is something that you want to be aware of and you want to think about, especially when it comes to some of the secondary things with Parkinson's disease that it can help with, possibly change, possibly improve, and affect. If there's anything that we can do to affect something, it's always nice to have tools, and that's really what these are. So question 1 there, why should I practice breathing exercises? Great, I breathe how I breathe. Why do I need to think about that? Well, there's really 3 major reasons, and then there's kind of some secondary reasons that we'll get to later. But the 3 major ones, the first one is an improved functional cough. And functional cough, it just means that you're able to have a nice, strong cough. Let's say if you have to cough something up. And this can be really important, especially at preventing or decreasing the risk of things like aspiration pneumonia. So if you think about a situation where maybe you've drank something or eaten something and we've all had it go down the wrong pipe, and now you're coughing like crazy, right? because your body wants to get that out of the windpipe. It's not supposed to be there. And so your just reflex is to cough. If you don't have a strong cough, if that's a struggle for you, then coughing something up is going to be really hard. And that increases the risk of aspiration pneumonia, because that's essentially what an aspiration is, right? Something gets in there that's not supposed to be in there and you can't get it out. You also have things that apply to coughing, like chest congestion. Let's say you get a chest cold. Let's say you get some fluid on the lungs. Being able to cough that up can be a big deal, to get it out, to clear things. And to be able to clear your own lungs is really helpful. It doesn't let kind of that gunky stuff just sit there and fester. And so having a functional cough is really important. Improved swallowing function is also another benefit to practicing things like this. Obviously, swallowing important from the viewpoint of no one wants to choke while they're eating, right? That's kind of important. But then you also start getting into things like dysphagia. And dysphagia basically means that you can't functionally swallow something, or you can't swallow well. And this can be a problem. This can be a secondary impairment with Parkinson's later in its progression. And so if we can maintain good swallowing function and help you ingest food safely, that can really matter. That can really help an outcome. Not only does it help in terms of choking, obviously, but let's say you go to the hospital for something and they want to do a swallowing assessment on you. That can help with the type of diet that they end up prescribing. You know, you've heard probably of people getting prescribed things like a soft diet or something like a honey thick or all liquids. And, you know, we all like food. It tastes good. It feels good to eat. And so to be able to preserve that function is really a bonus, is really a good thing. You know, prolonging and maintaining good swallowing function is really important. The last one there is improved phonation, and phonation just means how easily and loudly you can speak or project your voice. Many times, and I remember seeing this a lot with my past patients that had Parkinson's disease, people can experience a difficulty with phonation as the process progresses. And this means that you can't speak as loudly, it's hard to project your voice, and this can really matter when you get into situations of asking for your own care, asking for help, directing your own care. You know, let's say you're in an appointment with your doctor and you have some important questions, or there's something that you want to make sure that they know before you move on to the next item on the list for that appointment. Can you get your point across? Can you speak to where someone can understand you? Can you speak loudly enough that you're sure you can be understood? And so being able to maintain that phonation is really helpful. Some of this stuff will reoccur with the next two questions, but we'll move on from that first one. So question number 2, why is posture so important? And there's a couple reasons for this. You can see I've got kind of a couple short sentences there, and we'll expand on that. So posture is really important for good muscle balance. If you think of that first picture from the first slide, where you could see someone with nice, good posture, head stacked on top of shoulders, and then that progressive droop forward. And as your head and shoulders progressively droop forward and your head kind of shifts forward in front of your shoulders and the core of your body, it starts to put more and more strain on the muscles in the neck and the upper back. Your head typically weighs about 8 to 10 pounds, depending on how big your noggin is. And every inch forward it goes out of that neutral posture, it'll put approximately 5 or more pounds of strain on the tissues trying to hold it up. And that's a lot of strain. It can create a lot of back pain, It can create a lot of strange muscle adaptations. So the muscles in your neck that connect to your head will get really short and tight. The muscles in your upper back with your shoulder blades will get really lengthened out and weak. And so we just get some strange muscle imbalances and things don't work together the way that they should. A good way to think about it, if you're having trouble visualizing that, is if you think about picking up a gallon or a quart of milk. It's probably much easier to pick it up in your hand if you're holding it close to your body. Now think of how difficult it would be if, holding that quart of milk, you tried to straighten your arm out away from your body and still hold it up like shoulder level. It's going to feel a lot heavier. It's going to feel a lot harder. And so that's kind of what's happening here. Also with posture, so that second point, can prevent things like a fall from festinating gait by maintaining proper parameters around center of gravity, is that COG. Or, postural stability could be another way to think about this. And festinating gait is basically when, very common in Parkinson's disease, you get caught in a short shuffling gait pattern that's hard to break because it's harder to change your motor patterns in Parkinson's disease. Now, not only do you have a gait pattern that is set up for a trip or a fall, but with that forward drooped posture, you've got a lot of weight shifted forward outside your center of gravity. So there's more to control, there's more momentum going forward that's going to be harder to catch. And so you've got now a couple things at play that really just increase your risk for a fall. And so that good posture, keeping everything where it should be, nice and stacked in alignment, just kind of makes it easier for you to control your center of gravity. So the next one under that bullet, still in number 2, body position can also affect swallowing and breath coordination, aka improving your swallowing. And so with this point, we really want to think about the head posture and where that windpipe is in each of the head postures, right? So when you're nice and stacked with your head on top of your shoulders in good alignment, your windpipe is nice and neutral. And there's no major turns or kinks or anything. It's where it should be. And so it's open, it's a little bit easier to access. As your head goes forward, now we start getting into kind of a strange position for the windpipe. It has to curve in a way that it's not supposed to be all the time. And that can make things a little bit harder when it comes to swallowing or breathing properly. And if you want to test this out, move your head in different positions and see how different it might feel to try and swallow in that position. If you lay down and you let your head hang off the bed, or if you're laying down with your head sideways or turned all the way to one side, you'll notice that certain positions it's a little more difficult. And so if we can maintain that position, that's going to be helpful. The last one there, number 3, can I really build control into how I breathe? And if I can, so what? Why should I pay attention to this? Why does it matter to think about how I breathe? And what do you mean by control? Well, breathing is, to an extent, a natural reflex of the body. The body wants air, it needs oxygen. But how you breathe is largely under your own control a lot of the time. So how fast you breathe, how deep or shallow you breathe, and all of that matters. So just like other exercise, you can control your breath more than you think if you practice specific patterns and train the muscles that help you breathe. One of the exercises we'll practice later on in the 3rd presentation in the series has been shown to help with nervous system regulation of what's called the sympathetic nervous system. And that's your fight or flight system. So, think high stress, high activity. And we want to keep that in good balance and keep it from being too active too much of the time, right? And so a good breathing practice can help down-regulate that and maintain a calmer system most of the time, which is more appropriate, right? We don't want to be in that high stress sympathetic state all the time. Good breath practice can also improve concentration and improve awareness, and we'll see that when we get to those breath practices in the third presentation in the series, which I hope you choose to join me for. So what now? All right. So I would suggest, if you're still interested in this, which I hope that you are, because it definitely matters, take the next segment in the mini series. In the next segment, we're going to talk about some stretching and mobility. So if you notice when we did that breath awareness practice, if your chest feels tight or stiff, if your upper spine feels tight and stiff, back where your shoulder blades are, if it's hard for you to get into good posture, if that feels uncomfortable, like you're fighting against your own body, we're going to talk about some ways to open up. What are some good stretches? What are some good mobility exercise that you can do to help? And what the heck is the difference between flexibility and mobility? And why does that matter? And why should we practice both? And so that's what's coming up next. And so I hope you join me for the next one, because it's always good to have a quick practice, some quick actionable steps that you can do. And that's what it'll be. Some easy things that you can do on a daily basis to just help you move and breathe better. And we all know that that feels good, to move and breathe well. So if you have any questions, or you can see my little pup there again. That was actually just a couple days ago here in Ohio, walking through the snow. If you want to just say hi to Winston, you can feel free to email me at the email address listed, and I'm happy to answer more specific questions if you have them, or if you're interested in something like the Rock Steady Boxing program or other programs. There's a lot of great Parkinson's exercise programs out there to get involved in or try to find resources about. I'm happy to help direct you to those. So hopefully we'll see you in the next mini series, and we'll talk to you soon. Good luck on your breathing.